This presentation will deal with the topic of gender and its impact on disaster resilience. We're not going to sit on the fence with this one. We're here to argue that women are more vulnerable than men during a disaster. When we talk about women, we'd like to be clear that we aren't referring purely to cisgender women, but trans women and non-binary also. And it's important for us to establish that whilst we're going to talk about women as a collective, we absolutely need to acknowledge the intersectionality of vulnerable groups. We recognise that factors such as race, religion, and disability will intersect with gender to make a person even more vulnerable in a disaster. On the whole, women are affected more than men, but some women are affected more than other women. But we only have 10 minutes, and so we're going to talk about women as a collective. To consider if gender impacts disaster resilience, we first need to define resilience. The Red Cross defines resilience as the ability of individuals, communities, organisations or countries exposed to disasters and crises and underlying vulnerabilities to anticipate, reduce the impact of, cope with and recover from the effects of adversity. Now, the word vulnerabilities is key here because what we know about resilience is that it is inversely related to vulnerability. So let's talk about vulnerability. In the context of disasters and crises, vulnerability is the condition which increases the susceptibility of an individual or a group to the impact of the hazards. These conditions are determined by factors such as physical, social, economic, and environmental. People affected by disasters are usually disproportionately drawn from the margins of society. So what we're looking at here is children, elderly, people with disabilities, ethnic minorities, gender minorities, and women. So what makes women more vulnerable and therefore less resilient during a disaster? Well, although a disaster may be initiated by a natural event, its effect on society is grounded in the social structure of that society. General inequalities between men and women mean that women and girls are disproportionately susceptible to the consequences of climate change and disasters. In many countries, the woman's role is to look after and protect children, the elderly, and the sick, as well as maintain the family's home. Generally speaking, they shoulder the burden of what is called free labour. And a woman's workload increases dramatically after a disaster. While the psychosocial effects of the disaster are felt by both men and women, women more often have the increased workload and responsibility of family care, which is exacerbated by limited support structures. With this free labour often comes economic insecurity, and this inequality will contribute to increased vulnerability for women in times of disaster. Women are less likely than men to be in formal employment, and the primary family income is often managed by the male head of the house. An example of this is the 2004 tsunami in Sri Lanka. The government's tsunami compensation scheme saw cash relief paid only to the male head of house. Women's economic marginalisation and dependence on men worsened, increasing their vulnerability to this disaster. So that's a very brief summary of why women are more vulnerable to the effects of a disaster. And now we're going to talk about how they are affected. And just a content warning, I am going to talk about violence against women. Worldwide, violence against women is the most pervasive abuse of human rights. Data from the United Nations indicates that for women between the ages of 15 and 44, violence causes more death and disability than cancer, malaria, traffic accidents, and war combined. During a disaster, people may become displaced from homes, forced to live in overcrowded settlements. There may be a disruption to structures such as social networks, access to resources and services, as well as a breakdown in law and order. United Nations reported widespread sexual abuse of women following the January 2010 earthquake in Haiti. In the days following the disaster, women and girls were raped in refugee camps. Studies indicated 14% of households reported at least one member as a victim of sexual assault since the earthquake. And this isn't just a third world problem. The rise in gender-based violence following climate-based disasters has been observed in both developing and developed countries. In the year after Hurricane Katrina struck New Orleans, there was a significant increase in incidents of sexual assault and violence against women. And Australia is not exempt from this trend. Research into family violence during and after significant bushfire events in Australia has indicated an increased level of violence against women. On December 26, 2004, a tsunami struck the coastline of multiple South Asian countries. In Sri Lanka, more than 30,000 people were killed and 860,000 people displaced. Prior to the disaster, an estimated 60% of women in Sri Lanka had experienced domestic violence. But the frequency and severity of violence against women increased in the aftermath of the tsunami. From the very onset of the tsunami, girls and women in affected areas were subjected to rape and other forms of physical and sexual abuse. Local women's support groups reported receiving over double the number of referrals for domestic violence support services during the period following the tsunami. Reported incidents in accommodation centres included a man severing his wife's leg with a shovel, and another stripping his wife naked in public and attacking her with a broken bottle. A woman reportedly died after being set on fire by her husband, following a dispute over his expenditure of the family's compensation money on alcohol. Interviews with survivors indicated a belief that domestic violence was fueled by a combination of factors, including psychosocial trauma, stresses and pressures associated with loss of homes and livelihoods, poor conditions and lack of privacy in accommodation centres, and increased alcohol consumption. Lack of security and chaotic conditions in camps that were forming created further environments in which women and girls were vulnerable to violence. As well as the increase in violence against women, the reproductive health needs of women are too often neglected during and following a disaster. Today, there are 100 million people in need of humanitarian assistance around the world, and about 26 million of them are women and adolescent girls in their childbearing years. Sadly, 3/5 of maternal deaths today occur in countries that are considered fragile because of conflict or disaster. Pregnancy and childbirth kill 507 women every day in these settings. In times of disaster, women and adolescents are more vulnerable to sexual violence, unwanted pregnancy, and sexually transmitted infections such as HIV. Basic needs for safe childbirth, family planning, and reproductive health are compromised and are rarely met when women and adolescents become detached from the lifeline of health systems. Hurricane Katrina was a Category 5 hurricane that made landfall on Florida and Louisiana in August 2005, causing catastrophic damage, particularly in the city of New Orleans and the surrounding areas. Katrina caused extensive destruction and casualties. Overall, at least 1,836 people died in the hurricane and subsequent floods, making Katrina the deadliest United States hurricane in over 70 years. It's estimated that approximately 56,000 pregnant women and 75,000 infants were directly affected by the hurricane. Women with high-risk pregnancies due to complications such as diabetes or hypertension struggled to get the appropriate medical attention due to the limitations in resources. Hurricane Katrina saw a rise in infant mortality. The infant mortality rate for the affected areas was 9.4 per 1,000 live births in 2002, compared with a national rate of 7.0 per 1,000. Why was this so? Well, because natural disasters such as Katrina can result in a substantial disruption of public health systems and infrastructures that are essential for prenatal, intrapartum, and postpartum care. A specific example was the disruption to the Louisiana Newborn Screening and Follow-up Program. This program is to screen newborns for early identification and treatment of conditions that result in mental retardation or life-threatening conditions, and this testing was not performed for a long period following Hurricane Katrina. There are steps that nations can take to flip this scale. The vulnerability of women to the effects of disasters needs to be addressed. Measures should be implemented to increase women's access to resources, particularly in the case of reproductive health. Allowing women greater economic independence will also help them to regain some power and equality. But primarily, gender must be a focus of disaster management policy and program development, and practice must be monitored to identify gender bias. Thank you.